Okay. So, good, Guido. Well, listen in because we're going to be talking to Alex. Your last name is Glaros, and he's with MedZed. And MedZed is a telemedicine company. I'm going to let him talk a little bit about what MedZed does because it's a real interesting company. So go ahead.
Yeah, hi. MedZed is a local Atlanta-based startup company. We started out here in the Atlanta market going to the house to see pediatric patients. We send a caregiver or nurse to the house. We connect back with a physician for basic exams, save you trips to the ER, the waiting room, and give you convenient care.
That seems to be the trend these days. I mean, people just, want a physician. They want more of that specialized care. They don't want to be, say, waiting in the ER. There's no time. So this is kind of a good way to do it, isn't it?
That's right. Yeah, I just saw somebody say telemedicine is the way of the future, and so we're using telemedicine as a tool. We think that it is a great tool to use to offer people a convenient service, but we're also putting the caregiver into the environment. So not only are you getting that telemedicine, that technology component, but you're still getting a physical exam.
Yes, exactly. So it's not just, it's an awesome service. Thank you, Guido. Especially right now, Alex was telling me that they started out using it for children, targeting moms, but now more and more they're looking into helping senior citizens because they have sometimes an issue getting out to the doctor, right?
Yeah,
Tell us a little bit about that.
So like kids who have a demand to the parents or somebody has to drive them to the doctor. A lot of seniors have the same problem. So the convenience of getting out applies to them too. But it's much greater because their problems can compound onto each other. So MedZed's in the process of launching our first senior elderly care program in the LA market, partnered with a hospital system there to go out and deliver care for high-risk seniors.
Mm-hmm. So how would a senior citizen or a caregiver find out about the program in LA, for instance?
Well, the program is not direct to consumer. It's offered through the hospital or the delivery system that the patient is currently with. So there's a great complement there as well. They get the continuity of care. They're seeing the provider who has their history, their health records, and knows that patient. So we're complementing the current care that exists.
It's amazing how many changes are going on in healthcare today with telemedicine, health analytics, digital tools, wearables. It's just incredible what's happening. And what do you think the future is going to be like?
The Jetsons?
The Jetsons, yeah.
And it is amazing. We're seeing tons of companies. I'm here today to meet some other local Atlanta-based startups who are playing in the same space, or we may have some synergy and can complement or collaborate with each other.
Mm-hmm, great. Yeah, we're at Health Connect South, and we're at the Georgia Aquarium. You can see the background, all the. Great. I know. It's a great story. It's really a great story. It's really great for Atlanta. This conference is bringing together university, businesses, the CDC to collaborate, to share research. And Atlanta's it's the health IT capital of the country. It's known for innovation. We have Georgia Tech, we have Emory, we have Kennesaw State, we have Georgia State. We have all these universities here, and it's a way to bring everybody together. And this beautiful place, the Georgia Aquarium. So we're happy to be here, happy to meet Alex. Yes, Alex, they like what you're saying, Alex.
I'm trying to read the notes here as they come. That'll be epic.
Our senior populations need this. She says our senior populations needs this because it's true. I mean, falls are one of the biggest risk factors for other injuries and sickness.
And one leads to the next, and so we think that care should be proactive rather than waiting for a catastrophic event, and that's what we're committed to doing.
Right, and also it's not like it's better care, but it reduces costs as well. So that's what it's all about.
If we can intervene and be proactive, we can hope to avoid expensive events.
Right. Well, thank you, Alex. I appreciate it.
I appreciate you coming out. Visit us at mymedzed.com.
Yeah, mymedzed.com is the website. Oh, good. So Quita said she's going to come. Definitely visit them and see what they're all about. Well, thank you, Nicole. I appreciate it. We're having a good time here at the aquarium and learning a lot about healthcare in Atlanta. So thank you so much. Appreciate it.